Hello! I got this comment on my last video. In that video I talked about naturopaths and chiropractors and how they shouldn't be considered real medical doctors. So I got this question: would you consider a doctor of podiatry a doctor? The answer is yes, I would. Doctors of podiatry, podiatrists, they go through an undergraduate degree and then they go through multiple years of podiatry school and then they go through on-the-job training similar to what I did as a resident. Their focus is on diseases of the foot and ankle, and that's where they work. They work hand in hand with orthopedic surgeons and vascular surgeons. As a hospitalist, the number of podiatrists I've worked with who've worked hand in hand with those other fields and have provided great care, they're fantastic. The other question I got was about ODs, doctors of optometry. Same thing. They go through an undergraduate degree, they go through 4 years of optometry school, and then they focus on diseases of the eye. I've gone to an optometrist since I was 7 years old. I've worn glasses since then. Obviously, I'm wearing contacts now. They focus on routine care of the eye, but they can go into some of the diseases that affect it as well. If things get more complicated, or if the patient requires surgery, then they're often referred to an ophthalmologist, who also does some of those routine care things as well. But they work hand in hand, and they're a valued part of the team. My problem is not with the term doctor, or people using that term. PhDs have been considered doctors for longer than medical doctors were considered doctors. They've worked hard, they've done the research to get their, in their field of expertise, and they've earned that title. But context matters. I don't go to my eye doctor's office and say, I'm Dr. Joseph Thomas, because that's not my field of expertise. In the hospital, that's different. Here's what it is. Science has gaps. We know that science cannot explain everything, or at least we have not discovered enough of the science to explain everything. The problem happens when people try to fill in those gaps with pseudoscience or grift. Naturopathic schools start with the basic sciences, but then in the interest of holistic treatment, they go into these pre-scientific concepts that have long been debunked by actual research. Things like vitalism, treatments like ozone therapy, things that we did the research on and found that they don't work and sometimes even cause harm. But instead, the naturopaths will use these treatments because they're considered holistic, and then will detract people from the actual science and may even cause harm that way because they don't seek evidence-based medical care. There are unfortunately a lot of chiropractors that will do the same thing. There are some that are trying to go the evidence-based way, but there are too many of them that go far beyond their scope, or they do things that are really not evidence-based, or they're dangerous. And there's also no evidence-based reason you should bring your baby to a chiropractor. I understand that there are MDs and DOs that also use pseudoscience to enhance their own gain. You'll find that I call those people out too. Thankfully, they're a minority, although they are a very vocal minority. But that's part of what this account is for, and part of what we should all be doing as evidence-based physicians is calling out those grifters.